are known as an engaged and value-based organisation, and that begins with the board. What we've tried to do, particularly through our Members' Council, is to encourage people who've used services to become quite active participants in the governance of the Trust. Out in our localities, we've encouraged a number of groups to be formed, which involve service users and carers, dialogue groups. And I think that kind of builds up that feeling of public membership and engagement in a way that quite often organisations don't do it.
Although it's an award for board leadership, it actually reflects leadership across the whole Trust. We're really putting ourselves forward now for Trust. So we're trying to put our head above the parapet to try and be recognised for things that we're good for. Creative Minds has won a couple of national awards. The CAMS service in Barnsley has won an award in reflection to its children's work with the criminal justice system. And we also think the board does some very good things.
It sets the tone for the organisations. So if the values are the kind of guiding compass, so for example, putting the person first and centre, showing respect, I think they're two of them, and being open, honest and transparent. All of those are kind of underpinning conditions that would point towards a board that can act with compassion.
The board at Barnsley Hospital Foundation Trust is a really strong board, I think. The thing that shines out more than anything else is our care for the patients and for the population of Barnsley. So everything that we do is around trying to make things better for those patients, trying to make sure that we give the optimum care. Quality and patient safety are the two watchwords that we have in every board meeting. We've got a fairly diverse board, some fairly young members, but some people with lots and lots of board experience from different industry sectors. And that melds together in a board that actually drives the organisation forward as fast as we can. We put a massive amount of work into turning the Trust around. We found out that we'd got a serious financial issue. And rather than hide from that, we really got stuck into the financial issues. Leadership is the most important thing at board level. Clearly setting a vision for the organisation and then delivering that vision. But the real part of leadership that we got right is that we set that vision by involving our staff, by bringing our staff into everything that we do. So we listen to our staff as well, listen to our patients, listen to our governors, and the leadership that Diane and I provide, I think, as well as the rest of the board, brings that into really solid organisation. I really do believe that good leadership translates into better patient care, because the message from the board to the shop floor, if you like, is quality of care. We've spent a lot of time in the NHS talking to staff about the priorities, and the priority is quality of care. I think it's a reflection of the work that the whole hospital's done.
I think leadership comes down into three things for the board: strategy, culture and accountability.
We like to be out there, very visible, both to our staff but also to the community we serve.
We have introduced a board on the road process, so every board meeting we go out into the district, have a public meeting, have a presentation about key issues facing the Trust, issues around patient experience, engagement with service users, carers, and basically our external relationship is built around those board on the road programmes.
It's important to us to be out on the road, meeting people, talking about the services we provide, but also listening to what people have got to say, what have the staff got to say, what the community's got to say about the services we're delivering.
One of the things that the board is definitely focused on is the impact on patients and carers, and that's one of the things that we've been doing over the last 18 months through a You and Your Care programme.
It's really important that we've got a positive culture, that people are embracing change, thinking about the future. And that really requires very effective leadership, not just from the board, but at all levels of the organisation.
It's fundamentally what we do in the Trust, putting the patient at the heart of everything we do.